続きまして、報告3に移らせていただきます。アジア諸国における新型コロナウイルス感染症、蔓延下の労働移動の課題と政策的対応と題して、ILO、アジア太平洋地域事務所シニアエコノミスト、ニリム・バルア様よりご発表いただきます。また、同時通訳に対応したプレゼンテーション資料をチャットを通じて配信しますので、適宜ご利用ください。なお、オリジナル言語による資料は、後日、セミナーのウェブサイト上にアップロードいたします。ニリム様のご略歴をご紹介いたします。ニリム様は、1986年、カナダ・カールトン大国際関係学修士を修了された後、2002年から2007年、ジュネーブの国際移住機関において、労働移動部門に勤務。その後、東南アジア、東欧、中央で実施された ILO の労働移動技術協力プロジェクトにおける ILO の技術アドバイザー責任者を務められ、2011年より現職についておられます。また、国際労働移動、雇用、送金に関する多数の著書をお持ちです。なお、ニリム様にはオンラインでご参加いただきます。それでは、ニリム様、よろしくお願いいたします。
Thank you very much for the introduction. Can I confirm that you can see the presentation? Thank you. I'd like to thank the organizers for inviting me today, and it's an honor to talk to you at the annual seminar. As you know, COVID-19 has impacted all movements across borders, including labor migration, and hence it becomes important to look at the labor migration challenges and the policy responses that have occurred during the pandemic. My presentation is based on a chapter of a forthcoming publication, which is published every year by ADBI, OECD, and the ILO on labor migration in Asia. And I will cover a number of areas and therefore have to move quickly. Firstly, an introduction and the job losses that occurred in Asia Pacific, access to health, occupational health and safety deficiencies that occurred and responses. The issue of housing and accommodation, which really hadn't been focused on very much before, but was magnified during the pandemic. The importance of access to social protection and income support, which became very critical during the pandemic. And then the question of when and if labor migration is going to resume. With regards to job losses, the ILO has estimated that in Asia Pacific, there were 8.2% of working hours lost in 2020 compared to the pre-pandemic times in 2019, which translates to millions of full-time jobs that were lost and affected. Within this, there was more decrease in women's unemployment, and women's employment decreased from 3.8% in 2020 compared to 2.9% in 2019. There was a recovery in working hours in 2020, but that has stalled in 2021 with a gap of 3.2% remaining compared to the last quarter of 2019. Job losses amongst migrant workers is not measured in all countries or is not comprehensively looked at, but we have some data. In the Republic of Korea, the unemployment of migrants rose by 2.1%. In Japan, at the end of 2020, the technical intern training program halted, affecting 51,000 migrant workers. In ASEAN, an Ilo survey, a rapid assessment showed that the oil and gas and seafaring and construction industries were hardest hit by contract terminations. With regard to access to health, we have heard from a previous presenter that in Canada, the seasonal workers had a higher rate of infection, and that is seen in some of the countries in Asia as well. Generally, in the Asia region, this region became a global epicenter of the pandemic in 2021, as you know, impacting all groups and in particular migrant workers in some countries. In the Republic of Korea, however, 2021 data suggests that the migrant infection rates were on par with the population as a whole, but elsewhere, migrant workers faced high COVID-19 infection rates due to a number of factors, including overcrowded and congested housing and jobs with limited possibility of physical distancing. In Singapore, for example, by mid-February 2021, more than 90% of the total COVID-19 infections were from migrant workers living in dormitories. In Thailand, in mid-2021, COVID-19 cases amongst Cambodian, Laotian, and Myanmar migrants were at least 3 times higher compared to Thai nationals. And by November, this had fallen to 2 times higher. Similarly, in Saudi Arabia and Kuwait as well, the infection rates, and in Kuwait, the excess deaths amongst migrants were significantly higher. Overall, migrant workers had access to testing and treatment like nationals, similar to nationals as per policy. However, there were practical barriers such as the lack of and slow translation to migrant languages, insufficient hospital capacity, especially during peak periods, concerns about detention and deportation if migrants have irregular status. There were also positive steps taken, such as in Singapore, where all migrant workers were entitled to free testing and treatment, and it was mandatory that healthcare personnel can communicate in the major migrant worker languages. Migrants in Saudi Arabia and Qatar had access to treatment irrespective of their migrant status. In Malaysia, initially, migrant workers, including in irregular status, were provided free testing and treatment. But however, the policy was reversed later to not include undocumented migrants. In Thailand, the policy for COVID-19 healthcare to migrant workers has been challenged during peak periods by insufficient bed capacity. One impact has been that across Asia, governments have increased health sector funding, including in countries of origin, which has had a positive impact on access to health, and many countries of origin do provide free testing treatment to returnees, migrant worker returnees. Access to vaccines, as you know, is very important in overcoming the pandemic. However, in early 2021, when WHO conducted a global review of 104 national deployment and vaccination plans for COVID-19 vaccines that were submitted to the COVAX facility, most plans did not explicitly include migrants, and amongst these, most also did not include undocumented migrants. But we do know that in order to overcome the pandemic, all people within the country have got to have equal access to testing, treatment, and vaccinations. There are also some success stories, and in Singapore, by mid-November 2021, fully 98% of migrant workers in dormitories were fully vaccinated. In the Republic of Korea, the government offers vaccines to all migrants and has issued communications that it will not enforce deportation for undocumented workers if they come forward for vaccination. In Malaysia, there have been some initiatives taken to have outreach amongst undocumented workers, but the raids and arrests have caused hesitancy amongst undocumented workers to come forward for vaccinations. In Thailand, domestic workers who are mainly women faced barriers for vaccination because migrant workers who are either registered under Social Security or the employers had to register them could have vaccinations, and many domestic workers did not fall in either category, and they are not included in Social Security, which is a big gap. The importance of occupational health and safety, always important, and there have been deficiencies with respect to migrant workers before the pandemic, but this became pronounced during the pandemic because, as we have heard before, migrant workers comprise a large number of workers in essential and frontline sectors, including agriculture, care, manufacturing. So they have had to continue working, sometimes in conditions where social distancing was not properly provided by the employers. They had to continue to work during lockdowns. There has been mental health impacts, increased risk of gender-based violence, and incomplete or non-provision of personal protection equipment by some employers, which we found in surveys of migrant workers in ASEAN countries. Policies in the region to prevent COVID-19 in workplaces range in terms of how much onus and responsibility is placed on employers and how restrictive these conditions are for workers. And here I'd like to mention in Thailand the bubble and seal method, which was adopted in many of the migrant reliant sectors like construction, seafood processing, as well as manufacturing. Bubble and seal is where workers remain within a workplace accommodation transportation bubble. And while this has allowed key industries to remain open, including export-oriented industries, it has also provided workers income during COVID, but there have been cases where bubble and seal have not been implemented well, and this has ramifications for workers. And we have seen that workers have reported not being able to access properly food, water, or medical treatment, and also there is a mental health impact for prolonged, when there is a prolonged confinement in accommodations such as happened in the worker dormitories in Singapore or in migrant workplaces in Thailand, in construction, for example, where the accommodation is near the site, the construction site, and workers were sealed off at the site and where they were living. Well, substandard and crowded housing has been highlighted during COVID-19. Many migrant workers live in inadequate lodgings, which did not allow social distancing. In Singapore, the dense living conditions contributed to spread in migrant dormitories. In Malaysia, the Director General of Health acknowledged that cramped living conditions could have led to the spread of COVID-19 amongst migrant clusters. And in Thailand, the ILO found substandard living conditions among construction workers in a research it did in 2016. And of course, domestic workers who are women are compelled by law in some countries to live in the residence of the employer and is dependent on the employer for the accommodation conditions, although there are some regulations in countries like Singapore on the minimum standards which should be followed. There has been a response to the issues that came up regarding housing, and Malaysia has revised regulations to improve workers' housing standards. And they have also expanded inspections, carried out 22,189 inspections between February and July 2021, where 63.5% of employers were found non-compliant with the new regulations. Singapore has also revised standards for new dormitories in 2021. Despite these improvements, as you will see on the next slide, the national standards in Asian countries researched by ILO still remain low. As you can see on this slide, this is the minimum floor or personal space per worker, which is three square meters in dormitories in Malaysia, a bit higher in non-dormitory accommodation. In Singapore, post-pandemic, it has gone to 4.2 meters square. In Thailand, 3 meters square. Republic of Korea, I was surprised to find is 2.5 square meters, which is low. Now you can see Sphere Association. Sphere Association has produced minimum standards in humanitarian response. So this is for humanitarian situations like refugee camps, where they put forward 3.5 meters square living space per person. And against this, you will see in New Zealand, it is 6 meters square, which is much higher. And it would be interesting to see in Canada, what is the accommodation that is provided to seasonal workers. We have done a review of seasonal worker programs recently in Australia and New Zealand. And while countries like Canada, New Zealand, Australia may be providing better conditions and certainly better wages because their minimum wages are higher, it is important to look into areas like living conditions and also migration cost and recruitment cost, whether it is whether, for example, the airfare is being borne by the worker or the employer, because that makes a lot of difference. And as per ILO guidelines, it should be borne by the employer. Now, access to social protection and income support was, of course, very critical during the pandemic. And unfortunately, in many of the countries, the migrant workers did not have equal access to social protection and social security. And I think in the context of temporary labor migration, this is one area where temporary labor migrants are in a number of countries at a disadvantage because of the duration of their contract, and because it's considered temporary, even though they're coming to work year after year, they don't become eligible for certain social protection benefits such as pension, or in some countries even unemployment insurance or family benefits. Now, with regards to social protection, many countries did not include migrant workers in the same way as nationals in terms of income support and social protection. And here, if we look at at unemployment insurance, most countries in Southeast Asia, I don't know about Japan, but in Southeast Asia, with the exception of Thailand, and then we know otherwise that Korea, I mean, these are the two countries which do provide migrant workers in the formal sector unemployment insurance, which is good. In the case of, however, in both these countries, even in Korea and Japan, the income support that was provided to nationals during the pandemic were not provided to migrant workers. However, migrant workers, whether they are temporary or permanent, are contributing to the revenues of the government through the taxes they pay and should be covered during something like a pandemic with income support, just like nationals. In Japan, in April 2020, all Japanese nationals received a universal cash transfer of one-time aid, and initially migrant workers were not included in this, but after some critique, this included anyone who has resided in Japan for more than 3 months, regardless of their nationality or immigration status. In Singapore, the government did provide employers of quarantined workers with a subsidy and levy waiver, and workers during quarantine continued to receive their wages. Resuming labor migration, where are we today in terms of the labor migration flows? So labor migration flows have increased in the second half of 2021 compared to 2020 and are expected to increase in 2022 with health protocols in place. But however, currently they're much lower than what it was pre-pandemic in 2019. Pre-pandemic labor migration levels have not may not be reached in 2022. And as we all know, the abatement of the pandemic and therefore the resumption of labor migration at earlier levels is uncertain at the moment. However, key sectors in the region remain dependent on a migrant workforce. If we look at the inflows, and you can see Republic of Korea in the employment permit system, compared to 2019, a much lower number of workers have entered in 2021. In Japan, I have the figures of arrivals of foreign nationals, so it includes all arrivals, not just workers. And if you compare 2019 to 2021, there's a big difference. Policy in the GCC countries is that they have made vaccination mandatory for migrant workers. A good corollary to this is, in this case, they don't have to be quarantined for extended period. Thailand has introduced guidelines for the resumption of labor migration under MOUs with its neighboring countries. And also during the pandemic has undertaken the regularization of undocumented workers who are already in the country. In Malaysia, there was a suspension of labor migration in the elementary occupations, so-called low-skilled categories. And as a result, there's a big fall in the issuance of employment permits for this group. But the Ministry of Human Resources does expect more demand for workers in 2022. And standard operating procedures for migrant workers to come in have been drafted. Looking at the resumption of labor migration, some good practices and recommendations, there should be no difference between migrant workers and other entrants regarding health requirements. We found in one country there was, and have recommended that this not be done. Additional migration costs such as testing, quarantine, health insurance should not be borne by the migrant worker. And indeed, this is the policy in Japan, Malaysia, Thailand, but effective enforcement is required so that employers do not pass on the cost to the workers. Subject to developments in the way the pandemic develops or ends, fully vaccinated migrant workers should not be made to undergo paid quarantine more than 1 day, as this significantly increases the cost, even if employers have to pay, and it impacts labor migration. If there are labor shortages, then workers are needed for the economy. The practice of quarantine exemption or stay at home for vaccinated migrant workers is being followed by some countries, which is a good practice as it reduces costs. Finally, some conclusions. Migrant workers, while playing an essential role in the economy and in care work, were among the most vulnerable groups during the pandemic. Several countries provided access to testing and treatment, but they were practical barriers during the pandemic, and some migrant workers did not have good access. There have been success stories with respect to access to vaccines, but challenges faced by undocumented workers, domestic workers, for example, in Thailand, also faced barriers. Occupational health and safety became more critical during the pandemic, and there were deficiencies in OSH, which were seen, including some high-profile cases in Malaysia, for example, which resulted in measures taken by countries like the US on the import of medical gloves, etc. Bubble and seal measures allowed production to continue, but had ramifications on workers when poorly implemented. Improvements have been made with respect to minimum standard in accommodation, but standards still remain low and need to be improved further. Labor migration inflows is much lower than levels before the pandemic. Still, although it has increased since 2020. Thank you very much for your attention and time.
ミレム様、ありがとうございました。